An update tonight. Maine's Board of Pharmacy says it's making progress on rules for a new program aimed at increasing prescription access in rural communities. It comes after the I-Team found the board missed a deadline required by law to get the program moving. The I-Team's Dan Lamparello is live with what happens next. Dan?
Yeah, Katie, more than a month after that deadline came and went, the board says it's now working through some of the biggest questions about how this program will operate. One of them is defining exactly which communities should qualify for a remote pharmacy dispensing site. Now, the new law was passed to help communities without a local pharmacy like Jackman, where the nearest pharmacy is nearly 50 miles away. But before those sites can open, the board must first adopt rules spelling out who qualifies and how the program will work. They were required under that new law to have that process done by the end of June, but blamed the volunteer board's large workload for why they missed the deadline. Today, state officials called it a lesson they need to learn from.
As you know, rulemaking can take sometimes more than a year or two. So it doesn't feel great to miss a deadline, but nonetheless, these are deadlines we're never going to make, even if they were well intended. We want to better proactively communicate with our legislators and our committees to say, you've asked us, here where we, here's the status of these rulemaking efforts. So I think it's a lesson learned to communicate proactively.
Now, the board says they expect to have a draft rule for remote dispensing sites ready for review at their next meeting on September 3rd. It's something we're going to continue to follow. For the I-Team, I'm Dan Lamparello. Greg?
All right, appreciate the update, Dan.